Abortion is legal in South Africa, but illegal abortions are still prevalent. Ads for abortion services can be found on most city streets, but these are often illegal and dangerous. So why is there a gap for illegal abortion providers to fill? Well, let's find out from Victoria Satchwell from Abortion Support South Africa. A very good morning to you, Victoria. Thank you so much for your time. I mean, we're not in the United States of America here, where essentially the government is saying to you that you cannot have an abortion. Here it is, we've got a number of facilities that you can go to, some of them understandably so. You have to pay for the services, it is not free, but the service is there. Women are able to go in there and get the service. The law is not saying that it's not allowed, and yet there are still illegal abortions. There are still, backstreet abortions that are happening, and women are losing their lives. I mean, how is it that there is that gap? How is it that there is that market?
Mm-hmm. So thank you so much for having us here and for talking about this important topic. What we're seeing is that an estimated 50% of abortions are actually still happening in the informal sector. And as you point out, that is a problem from a safety perspective because those, the safety of those abortions can't be guaranteed. But also it's a financial thing. Women are paying often extortionate amounts of money to access services in the backstreet, the informal sector, when they could be accessing services for free in government facilities. So that really indicates a problem, that women feel that they can't go to government facilities. And the research shows us that the reasons are that women are actually scared to go to clinics. They're concerned about their privacy as well. And that is because there is some mistreatment in clinics, that hospital staff are not treating women compassionately. It's also because we're seeing a lack of facilities, so there aren't enough hospitals that are providing abortions. We're seeing a lack of willing and trained providers, so we do need more staff providing there. And we're also seeing that staff are actually opting out of providing abortion services, and this is what we call unregulated conscientious objection. So we're seeing a lot of problems coming together where women are not able to go to those government facilities, and for that reason they are choosing to go to the informal sector.
What I'm hearing here is perhaps an issue of a lack of education, at least for, the healthcare providers who are, tasked with providing the service of abortion. It could be a lack of education or perhaps just a poor EQ. Could that be the case, that people just, lack that compassion? They've grown up, they come from different backgrounds. Some of them have got, certain religious views where they feel like you cannot, they call it killing a child. That's what abortion is seen as, instead of, essentially looking after your own health in this particular case. Could that be the situation, that there is a lack of education and just, low EQ?
I think that it's a difficult environment to work in. We have a really overburdened healthcare system. I think that nurses really need more support in providing services. Sure, it's definitely a training issue. It's a reimbursement issue. Are our nurses being paid what they should be paid to do these services? And are they getting the support that they need to provide these services?
How do we deal with the situation, Victoria? How do we not have...
How do we solve it? Yeah.
How do we solve it? How do we not have a market?
Yeah, that's exactly what we need to be asking. We need to say, what can we do to make sure that women can actually access safe services and that they know where to go? And what has recently been happening internationally is there's been a movement, it's sort of demedicalization and democratization of abortion services, where we're seeing that the World Health Organization is saying that women can actually manage their abortions themselves. So that is abortion with pills, not the surgical abortions. And abortion with pills is an incredibly safe procedure, very effective, and it's something that women can really do themselves. So what's really great that's happening in South Africa now is Abortion Support South Africa is partnering with Women on Web International, a Canadian NGO that's provided around 100,000 abortions internationally, and we're bringing a telemedical option to women. And so what this will mean is that women can do an online consultation where they come in contact with a healthcare provider, and then they will get a prescription sent to their pharmacy, and they can go and pick up the pills there. And then we provide instructions, very simple, how to do a medical abortion yourself, instructions on how to do the abortion as well as aftercare. And this is a way that we can take the burden off of the government facilities. They still need to be providing those services. It's paramount. Not everyone can do an abortion this way. Not all abortions are eligible. But this is really a way that that we can say, we've got lots of pharmacies in the country, and this is a way that we can get the services out to women through this telemedical option.
I want to tackle the matter of cost here. You mentioned that the backstreet abortions cost quite a lot because you're running away from that humiliation that you'd be subjected to from perhaps a public health facility. But if then you have the money to go pay at a backstreet, why aren't you then paying for a private institution that does offer a safe abortion? I mean, is it really a matter of money?
I think in a lot of cases it is a matter of money. So it's that a private abortion can cost. They are quite expensive. You're going to be paying in excess of 2,000 Rand usually. You might be able to find a cheaper abortion in the informal sector. It's also unfortunately that sometimes women do not know that they can actually, that this is their right or where to access. And it's also that it's seen as a quicker method because going through our healthcare system, whether it's private or public, is going to there are hoops that you need to jump through that are often medically unnecessary. But people sometimes choose informal because they think it's going to be quicker and easier and less stigmatizing.
Yeah. Victoria, I want to take it beyond South African borders, and I want to go to India. All women have right to safe, legal abortion. This is coming from India's top court, and this is in a country where women are under siege, just as they are in South Africa. India is known, for things like gang rapes and such. Is this seen as a win for women? That and I'm not saying it's something that you can. It's a solution to a problem that they have, but you are able to then safe abortions, have them, and there's no stigma, I would hope, at least in India, especially after suffering something like a raping in India. Can this be seen as a win for the women in India?
Of course. If you've got any top official coming out and publicly saying this is something that is a right for women, that's definitely a win for women. Because having autonomy over your own body, over your own life, is just fundamental. If you cannot determine when and if you're going to have children, it means that there are multiple options in your life that are no longer available to you. It has financial implications, it has educational implications. You aren't able to take care of existing children you have. So any top official coming out and putting their will behind a statement like that is definitely going to reverberate into the lives of women.
And just very quickly before I let you go, Victoria, this is an incredible chat that needs to always be had, I think, and one that I myself am very passionate about. Do you feel that the United States has an opportunity to actually go back on the Roe versus Wade judgment and actually, allow women, to have that autonomy over their own bodies? Can they actually turn the judgment that essentially has put a bad light, a dark cloud over the United States and what they've decided to do?
I certainly hope so, and I think it's really been an issue that's galvanized women in the US, and there's been so much activity around that. And I mean, of course, we all have to be hoping that in every country in the world, that any situation where women's rights are being undermined in this way, that there is a possibility to change that, to turn that around.
We really do hope that, and we hope, this is an opportunity for, perhaps the UN to step in and try and put that pressure on the United States to allow women to actually have, this right, because it is their right. These are their bodies, and to tell them what to do with them is just really, it's cruel. It's cruel, I think it is. But Victoria, thank you so much for joining us and having this conversation with us here on the South African Morning. That is Victoria Satchwell from Abortion Support South Africa.